My name is Mohammed Owais and I'm a GP based in London. Firstly, we thank Allah for allowing us to embark on this journey. And I'd like to also thank Mr Zia and the Hassan Hajj team for facilitating this event today. So we'll just a brief outline of today's session, and we will need to go over things fairly quickly. So in terms of the Hajj journey, there are certain risks associated with it from a medical perspective. Obviously, it's going to be very, very hot, temperatures almost approaching 50 degrees and sometimes beyond. The environment will be different to what we're used to. It will be dusty. Many Hujjaj in one area, overcrowding and infection risk. And also the fact that there may be some issues with sanitation, particularly in Mina. And obviously the rites of Hajj involve us to be very physically active. In terms of prevention, I'd like to approach this from a point of view of our beloved Prophet ﷺ, where he spoke about health in numerous ahadith, asking us to make dua for it, and also it's something which is, we're essentially asked to seek medical advice and to seek medicine when we become unwell. If we take the sunnah and specific examples from the sunnah, there's many lessons that we can learn from a medical point of view. For example, hand washing. Before and after we eat, we're advised to wash our hands. Before and after we go to the toilet, we're advised to wash our hands in various points throughout the day. From a medical perspective, we actually know that this is one of the most important things when it comes to preventing infectious disease. As a GP, there's a common condition which I encounter, and it's a fungal infection of the toes, tinea pedis, athlete's foot. Interestingly, in Muslim populations, we don't see this disease very often. And it could be the fact that we wash our feet up to 5 times per day, with the Prophet ﷺ asking us to specifically clean between our feet. And obviously when it comes to food and nutrition, Prophet ﷺ has given us very, very specific advice about what to eat and how much to eat. And obviously it's very, very important in preventing disease. We all know the maxim that prevention is better than cure. And perhaps from what the Prophet ﷺ has advised us in terms of keeping healthy, that's incredibly important, and it's a lesson that we can learn from there. Now, how does this apply to Hajj? We'll be going over the medical conditions that Hajjis encounter, and actually all of the conditions, to a certain extent, can be prevented. And I want everybody to sort of try to take notes about these things. And Muhtadi and Mishkat have spoken very much about things that we can do to keep ourselves as well as possible. So in terms of preparing before we travel, Allah commands us to make preparations, and the best preparation is taqwa, as our Shaykh Mishkat has elaborated upon. In terms of preparations from a medical point of view, we must make sure that we have had our injections in the ACWY meningitis vaccine is mandatory. In terms of people that are high risk, so people over the age of 65, people that have other chronic healthcare conditions, you do need to speak to your GP about any other injections that you may need. In terms of footwear, and Muhtadi has spoken about this, from a medical point of view, footwear is incredibly important because blisters and foot problems are incredibly common. In fact, perhaps one of the most common things that Hajjis encounter. And poor fitting footwear, blisters, can actually impact on Hajj incredibly so. So as Muhtadi said, I definitely echo the fact that we need to start buy a good pair of footwear, start wearing it from today, and start walking in it for 10 to 20 minutes per day, as per advice, in the footwear that we'll wear in Hajj. There's no point packing it and using it in Hajj, and the first day we use it, we get blisters. In terms of medication, people that are on long-term medication, please take your medications with you, enough to last you the duration of Hajj. Please keep the medicine. From my point of view, I know inshallah there's low risk of luggages going missing, but please keep it in your hand luggage if possible. If you are on controlled medication, things that are sort of controlled in terms of tramadol or morphine patch or anything like that, the Saudi authorities are not so happy with that. So you will need a doctor's note, so notes from your GP to confirm that it's a prescribed medication that you're on. You'll be fine to take it, but you will need a letter. In terms of people that are on insulin, it's important that you have the device, the pouch, to make sure that insulin doesn't get too hot or cold. And if you have a GTN spray, so people that have problems with their heart, please keep your GTN spray with you. Keep an extra one in your bag. It's not freely available in Saudi Arabia. If you do have a complex medical condition, please do keep your latest hospital letter with you, which will have the name of your consultant, your medical problems, and your medication. Also, if you are in that category and you do have a complex medical condition, please make sure you've seen your GP, you've got the summary, and your GP is aware of your travel. So the Council of British Hajjis have done some research into the conditions which the Hajjis most commonly encounter, and we'll be going over these in a bit more detail. Self-care. Now, as Muhtadi has mentioned, self-care is incredibly important. It's very, very difficult to take care of the medical needs of a large group of people, and we do require everybody to take a degree of responsibility for their own health. There are facilities available in Saudi Arabia, so the 24-hour pharmacies are there in Saudi Arabia, which can be accessed obviously at any time. The people at the dispensary, they usually speak pretty good English and can dispense medication sometimes or majority of the time without a prescription. So that would perhaps be a good first port of call. In terms of if someone falls ill inside the haram, there are facilities available, and there are obviously private hospitals that can be attended in various places depending on where we are. And of course, in terms of self-care, priority would be, and I think you probably get sick of us saying it, keeping hydrated. And obviously taking your medications on time. Some people think when they go to Saudi Arabia, you don't need to take your medications anymore. Please do take your medications. So the Hajji cough, perhaps the most common problem encountered. Now what is it? Most likely it's a virus. There's people from over 140 different countries coming with their different strains of their virus from the different countries. Everybody's close together. So it's actually incredibly common to some degree that most people will have this illness to some extent. It's incredibly common. Alhamdulillah, it's not severe in most cases, and it's something that does pass. So we'll discuss the symptoms on the next slide. Essentially, because it's a virus, cure is very difficult. We don't have many very antiviral medications. We do have antibiotics, but we know it's a virus in most cases, so antibiotics are of no use. So what do we do with antibiotics? Now, if the doctor says take antibiotics, and you take antibiotics and it doesn't work because it's a virus, sometimes you're like, okay, the doctor said antibiotics and it's not worked. But conversely, if the doctor says no antibiotics, then you can be like, I've not had any medication and I'm still not better. So it's difficult from our point of view in terms of trying to decide who takes antibiotics or not. Things that we can do. I'm not sure if everyone can see. So when we go over the conditions, we'll try and look at things that we can do to prevent. So wearing a mask, and in Ihram there are some caution with regards to this, but definitely outside the state of Ihram, it's very, very useful to wear a mask. This illness is spread by what's known as droplet spread, so people coughing or sneezing is the way that this is spread. And the second point, if people have any symptoms, do try to keep away from them. It's very, very difficult, but certainly it's not a good idea to share drinks with somebody that has these symptoms. In terms of if you do get the symptoms, paracetamol, fluids, saltwater gargles, honey and lemon, lozenges and things like that. If you do have a pre-existing medical condition or if things are getting serious, you do need to seek some medical attention. In terms of the symptoms of the Hajji cough, so they're laid out there. When we get a cold in this country, or we say we have the flu, it's most likely the common cold that we've got. It's not actually the flu. The symptoms of the Hajji cough mimic actually proper influenza. So you can get very severe symptoms. So fever and chills, headache, a severe dry cough. You do get body pain. Symptoms can last up to 2 to 3 weeks. And the cough can actually persist for a number of months. In terms of dehydration, now with Hajj moving to the summer months, dehydration is very commonly encountered. We normally need about 2 to 3 liters of water per day. When it's very, very hot, as it will be in Saudi Arabia, and when we're walking, we can lose 1 to 2 liters per hour. It's very, very easy to get dehydrated. I know Sheikh Mishkat has spoken about the amount of bottles that he has to drink, and it's absolutely the case. It's not surprising at all. You will need to drink that many bottles. It's incredibly easy to get dehydrated. You didn't mention it today. In the Hajj of Fiqh class you mentioned, so if you watch the videos, Sheikh Mishkat mentions how many bottles he has, and it's an incredible number per day. We do need to drink that much. In Mina, I know there's some people that are afraid of using the toilets. I hate to say this, there's no other way. We will need to use the toilets in Mina. I think we all have to be a little bit mature about things. Our body has a right over us. We have made a commitment to perform Hajj. Our fellow Hajjis, the group organizer, and everybody, we have a responsibility towards them. So simply having a fear of not using the toilets and not drinking, I don't think is a good enough reason not to drink. Because if you don't drink and you don't use the toilet, you'll be going to hospital for dehydration. It's not something to aim for. It's a sign that your body is not coping if you're not passing urine and you're not opening your bowels. There's a risk of acute kidney injury. There's a risk of bowel issues. So please, please, please do eat and drink properly. It's not the time to go on a diet. It's not the time to try to lose weight. It's not the time to say, I'm scared of the toilet, so I'm not going to drink. Please. You may need up to 6 litres per day, perhaps even more. 6 litres would perhaps be a minimum. Just as a note here, if you do have a pre-existing heart condition, please do speak to your doctor before you leave about fluid restriction. So what can we do to prevent this? And essentially this is more or less entirely preventable. We can drink plenty of water and make sure that we are opening our bowels and we are passing urine. Heat exhaustion. Again, this is a complaint that we're seeing more often in the summer months. Heat exhaustion and heat stroke. So in terms of heat exhaustion, it's caused by increasingly high temperatures, us being physically active. So the symptoms that you get are listed, and it's high temperatures, feeling dizzy, feeling sick. What can we do to prevent it? And both Muhtadi and Sheikh Mishkat have spoken about things that we can do to prevent, things like wearing light-colored clothing, things like keeping cool, and there will be sort of spray cans of water available, using that regularly. Making sure that you're drinking water, handheld fans may also be a good idea. In terms of heat stroke, and that's one sort of, if you like, a degree above heat exhaustion, it is a medical emergency if somebody has these symptoms. So if they start to become confused and agitated, they do need, and the temperature is above 40 degrees, they do need to go to the hospital urgently. In terms of for the sisters' menstrual issues, please do see your GP prior to travel, and Sheikh Mishkat has spoken about this issue. In terms of the medication which is commonly prescribed, it's a medication which works very, very well. However, it does have to be taken 3 times per day. And that doesn't mean with your breakfast, with your lunch, and with your dinner. It means that you have to take the medication every 8 hours. So if you're starting at 8 o'clock in the morning, the first tablet, the second tablet should be 4 o'clock in the afternoon, and the third tablet should be 10 o'clock at night. If you're just taking it over a 12-hour period of time, then simply the medication will not work. So please do take the medication as prescribed by the GP every 8 hours. So things that we can do, take the medication regularly and seek the advice before travel, and start the medication on time as prescribed by the GP. Sore and crack heels. Now, as mentioned, foot care and foot issues are very, very commonly encountered, and more or less things are, again, entirely preventable. Keeping your skin moisturized, keeping your feet clean. Because of the heat, feet will swell. So trying to keep your feet elevated whenever possible, walking carefully, removing moisture from your feet before walking, removing dirt, and obviously prevention in terms of using the appropriate footwear, cleaning the feet, in terms of never walking on bare feet because there is a risk of burns. So if you do get a blister, what can you do? Clean it properly, apply a firm plaster to it, elevate your foot and rest. If it's not getting better, if it's getting bigger and it's more painful, you do need to seek some medical advice. In terms of bowel issues, constipation can occur, but also diarrhea. So the food that's provided by the team is perhaps the best food to eat. Do avoid the more exotic options which may be available in the street. Do make sure you're drinking in order to prevent constipation. And if you do have symptoms of diarrhea, just a word of caution about taking medication to stop the diarrhea. I'm not a big fan of taking medication. It's usually caused by infection of the gut. And by stopping your bowel motions with loperamide or Imodium, sometimes it's not the best thing. It's best for the infection to come out. However, obviously, if you are having bowel motions incredibly frequently, then you can take some Imodium. Just again, a word of caution about Imodium. It's not available in Saudi Arabia, so if you are taking it, you do need to take some with you before you travel. In terms of groin soreness, again, very commonly encountered. It's because we may be in the state of ihram. It's very hot. Rubbing between the thighs can cause incredible amounts of pain, actually, and it can make you just focus on that alone and not focus on the rites of Hajj. So using some Vaseline is very, very important, and that's perhaps the thing that everybody needs to do, is to buy some type of Vaseline and use that before you embark on your day. If you're in a state of ihram, it does need to be unscented. In terms of mental health, I mean, if you do have a pre-existing mental health condition, you do need to continue taking medications as mentioned. I think for everybody it's a highly stressful time, and as the Sheikh has mentioned, it's very, very important to try to keep patient, to try to not lose our cool. And it's not surprising that people sometimes do. It's very, very hot. You may be dehydrated. You may not have showered properly. Emotions will be high. So the things that we can do is to make sure that we are taking our medications if we are on them, making dua, anticipating and thinking about the fact that this will be a very stressful, potentially quite stressful situation we'll find ourselves in, and thinking about what we can do when we're in that situation. Slowing down, rehydrating and breathing will obviously be of help. In terms of, as Muhtadi mentioned, we do recommend seeking professional medical advice if problems do arise. In terms of the advice that we give, it can be taken or disregarded. In terms of a summary, again, we've mentioned it so much. Please, please, please do keep hydrated. Please, please, please do drink. Rest, eat well, take your prescribed medication on time. Please pay particular attention to the groin area and your feet in order to prevent problems. Most of the issues are preventable. Please follow the group advice. Jazakumullah khair. May Allah accept it from everybody. Assalamu alaikum wa rahmatullahi wa barakatuh.